Out of all the emotions, guilt is the only emotion that you can't handle on your own. I watched my friends burn to death on a dusty road in the middle of Afghanistan.
Joe is a Marine Corps combat veteran, still fighting a constant battle with depression.
I think the first therapy session I had, like the therapist just started crying, and I was like, what the I broke the therapist.
As an ICU nurse, we're used to losses. You know that not... Sorry.
Shannon is an intensive care nurse treating COVID patients in a New York City hospital.
You know that not every patient is going to make it, but I've never experienced 90% of my patients dying. I've also never experienced my patients having to die alone, with only me holding their hand as they die.
Such an angry dude, just so angry all the time. And I'm just exhausted.
Sydney is a Marine Corps combat veteran who calls violence his personal vice.
Violence being my tool for so long, I don't really know any other way to be. I feel the nerves, and I feel them wide open, they're sensitive, they're raw all the time, it's always there, and then something happens and I boil over, and then I'm wide open for days, weeks maybe.
3 people whose lives are ravaged by post-traumatic stress. Each one of them has attempted suicide.
I really do a hatchet job on myself. I become hypercritical. Everything, I'm fat, I'm ugly, I'm not a good nurse, I'm not smart enough, I'm not enough. That's really, at the end of the day, I'm not enough.
All 3 patients have come to the Stella Center in Chicago to get an injection known as the stellate ganglion block, or SGB. It's been used since 1925 to treat chronic pain.
Yep.
But Dr. Eugene Lipov has perfected its use for PTSD. He claims the success rate is more than 80%.
If somebody has a broken leg, and you have an x-ray of the leg, and it's broken, you don't ask somebody to walk on it.
He says post-traumatic stress is an injury too, and it's time the medical profession acknowledged that.
When somebody comes in with PTSD, they go, well, you're weak, something's wrong with you, you don't really have it. When you scan it, you go, oh, you have amygdala is hyperactivated. You have a problem, let me help you. Think how powerful that whole concept is.
The amygdala is connected to the stellate ganglion, a group of nerves in the neck that sends messages to the brain in response to stress. When it's overactive, it causes anxiety, irritability, hypervigilance, and sleep issues in a person with PTSD. Dr. Lipov injects a local anesthetic into the stellate ganglion, which resets it to a normal resting state.
Sydney, you did really well. You're all done.
The shot often takes effect immediately and can last for months or years. Up next, post-op and the immediate impact of the shot.
The colors are brighter.